Third, pay attention to what naturally draws you now, not what you think you should be drawn to, not what used to inspire you, but what actually calls to you in this moment. It might be spending time in nature. It might be creative expression that has no spiritual agenda whatsoever. It might be service to others in simple, practical ways. These natural inclinations, however ordinary they might seem, are breadcrumbs leading you toward your authentic expression. Fourth, find community that understands this phase. One of the most painful aspects of the post-awakening motivation crash is the feeling that you're somehow doing spirituality wrong. Surrounding yourself with others who have navigated this territory, who don't try to fix you or push you back into performative spirituality, can be profoundly supportive. And finally, practice radical self-compassion. The inner critic often becomes deafening during this phase, constantly comparing your current state to past spiritual heights or to idealized images of enlightened beings who never seem to struggle with motivation. This critical voice is not your ally on the path. Treating yourself with the same compassion you would offer to a dear friend navigating this difficult terrain is not just nice, it's necessary for the unfolding that wants to happen. Cyclical wisdom. Another framework that has helped me understand this process comes from cyclical wisdom traditions that honor the seasons, the lunar cycles, and the natural rhythms of expansion and contraction. In these paradigms, periods of seeming dormancy aren't seen as problems, they're recognized as essential phases in any natural cycle. Think of a garden. There are times for planting, times for active tending, times for harvesting, but there are also times when the soil needs to lie fallow. In traditional agricultural societies, farmers understood that forcing the land to produce continuously would eventually deplete it completely. Allowing fields to rest wasn't laziness, it was wisdom. Your spiritual life follows similar patterns. The post-awakening motivation crash can be seen as a necessary fallow period. Nothing seems to be happening on the surface, but deep in the soil of your being, crucial processes are underway. In many indigenous traditions, winter, the season of apparent death and dormancy, is honored as a time of deep replenishment. The visible signs of life may disappear, but underneath the frozen ground, roots are gathering strength. The apparent absence of growth is precisely what enables future flourishing. What if your current lack of motivation is actually your spiritual winter? Not a failure of practice, not a regression, but a natural and necessary season that carries its own unique gifts if you're willing to receive them. Motivation reimagined. As we begin to wrap up this exploration, I want to offer a completely different way of thinking about motivation itself, one that might help you navigate this confusing terrain. The word motivation comes from the Latin movere, meaning to move. At its root, motivation is simply about movement. What moves you, what causes you to act. In our achievement-oriented culture, we've come to understand motivation almost exclusively as a feeling, a sense of enthusiasm or drive that precedes action. But what if motivation isn't primarily a feeling at all? What if true motivation is simply alignment with what is genuinely yours to do in this moment? What if action can arise not from emotion, but from a clear seeing of what's needed now? This is the kind of motivation that can emerge after the post-awakening desert, a quiet clarity that doesn't depend on emotional enthusiasm. It's action that flows from being rather than from wanting. It's movement that arises naturally when the separate self is no longer desperately trying to achieve or become. I'm not suggesting that you'll never feel excited or passionate again. Those emotions will still arise, but they'll no longer be the primary fuel for your actions. Instead, you'll find yourself moved by something deeper and more stable, what some traditions call the still, small voice within. Transformed presence. One of the most beautiful descriptions of this state comes from the Bhagavad Gita, where Krishna instructs Arjuna, "You have the right to work, but never to the fruit of work." This isn't a prescription for joyless duty, it's a description of freedom. When actions arise without attachment to their outcomes, when movement happens without the burden of the ego's agenda, there's a lightness and ease that conventional motivation can never provide. In this state, you may find yourself doing many of the same things you did before, meditating, studying wisdom teachings, serving others. But the quality of these actions would be fundamentally different. They'll no longer be means to an end, steps on a ladder to some future enlightened state. They'll be expressions of what you already are, movements of the whole rather than strategies of the separate self. This shift is subtle but profound. It's the difference between pushing the river and flowing with it. It's the distinction between attachment to outcome and commitment to process. It's the contrast between effortful striving and effortless allowance. And paradoxically, this shift often leads to greater effectiveness in the world. When actions arise from this clear, unburdened place, they tend to be more precisely attuned to what's actually needed. There's less wasted energy, less friction, less of the exhaustion that comes from constantly swimming upstream against the current of reality. Final insight. We've covered a lot of ground, but I want to leave you with the insight that changed everything for me. The understanding that finally allowed me to make peace with my post-awakening motivation crash and discover what lay beyond it. Here it is. The disappearance of your old motivation isn't a problem to solve. It's an invitation to discover what moves you when you're no longer moved by the separate self's agenda. Let that sink in for a moment. Your spiritual awakening didn't kill your motivation. It revealed that what you've been calling motivation was actually a complex mixture of social conditioning, ego-driven desires, fear-based striving, and genuine alignment. Now you're being invited into a purification process where everything that doesn't arise from your authentic core is falling away. Yes, this process can feel like death. In many ways, it is a death, the death of an old way of being. But it's not the end of the story. It's the necessary clearing that precedes a more authentic expression of who you truly are. This doesn't mean you'll never struggle again. It doesn't mean you'll float through life in a perpetual state of blissful detachment. The human journey continues with all its messiness and challenge, but underneath the surface play of circumstances and emotions, you'll increasingly find yourself rooted in something that doesn't depend on feeling motivated in the conventional sense. You'll discover action that arises from presence rather than from the absence of something you're trying to fill. You'll experience purpose that flows from being rather than from seeking. You'll know a peace that doesn't depend on perpetual inspiration or constant progress. So if you're in that desert right now, if your motivation has vanished and you're questioning everything, know that you're not lost. You're exactly where you need to be. The emptiness you're experiencing isn't empty at all. It's pregnant with possibility. It's full of the potential for a way of being that you can't imagine from where you stand now. Your task isn't to force yourself back into the old motivational paradigm. It's to stay present with what is, to tend to what arises naturally, and to trust the intelligence of the process that's unfolding through you. Not because it will get you somewhere else, but because this presence itself is the gift that your awakening has made possible. The motivation you're seeking isn't ahead of you. It's beneath you, behind you, all around you. It's in the very ground of your being, waiting to be discovered when all the frantic searching finally comes to rest. And in that rest, something entirely new can begin. What's critical to understand is that your response to these different classes is highly individualized, based on your genetics, age, other health conditions, and even ethnicity. Research has shown that different racial groups respond differently to certain classes of blood pressure medications. For instance, ACE inhibitors are often less effective in individuals of African descent than calcium channel blockers or thiazide diuretics. If you're experiencing side effects or not seeing improvement in your numbers, it's not that blood pressure medication doesn't work for you. It's that you haven't found the right medication or combination yet. This requires persistent collaboration with your doctor and sometimes specialized testing that many seniors don't know to ask for. Monitoring mistakes. The sixth mistake is deceptively simple but has enormous consequences: incorrectly measuring your blood pressure at home. Home blood pressure monitoring is essential for seniors, but the way many people do it renders the results practically meaningless. Let me explain why this matters so deeply. The decisions your doctor makes about your medication, the adjustments to your treatment plan, and ultimately your risk of stroke or heart attack are all based on your blood pressure readings. If these readings are inaccurate, every medical decision that follows is compromised. The most common error I see is seniors taking a single reading and basing decisions on that one number. Your blood pressure fluctuates naturally minute by minute. Taking just one reading is like judging the weather for the day by looking outside for just 1 second. The protocol recommended by the American Heart Association is to take 2 readings, 1 minute apart, and average them. Do this twice daily at the same times each day for a week before your doctor's appointment. This gives a much more accurate picture of your cardiovascular health. Another critical mistake is the position of your arm during measurement. Your arm should be supported at heart level, with the bottom of the cuff directly above the bend of your elbow. A study in the Journal of Hypertension found that measuring with your arm below heart level can artificially raise your systolic reading by up to 10 points. Many seniors also use cuffs that are the wrong size for their arm. A cuff that's too small will give falsely elevated readings, while one that's too large will show deceptively low numbers. Measure your upper arm circumference and ensure your cuff size matches manufacturer recommendations. Perhaps most concerning is how many seniors take their reading immediately after physical activity, after eating, while talking, or with a full bladder. All of these factors can significantly skew your results. The proper protocol is this: sit quietly for 5 full minutes before measuring. Keep your back supported and feet flat on the floor. Don't talk during the measurement. Avoid caffeine, exercise, and smoking for at least 30 minutes before measuring. And always use the bathroom first. These may seem like minor details, but they can make the difference between a reading that shows your blood pressure is controlled and one that sends you and your doctor chasing problems that don't actually exist. Or worse, missing dangerous elevations that require immediate attention. The accuracy of your home readings is not just about peace of mind. It's about ensuring that every medical decision made about your cardiovascular health is based on reliable information. Life-saving awareness. And now, the 7th and final mistake, the one that could quite literally save your life this year. This is about the dangerous gap in awareness regarding how your other health conditions and medications affect your blood pressure and how this interaction changes as you age. Most seniors I work with are managing multiple health conditions: arthritis, diabetes, high cholesterol, sleep apnea, thyroid issues. These are common companions in the later years. What many don't realize is how profoundly these conditions and the medications used to treat them impact your blood pressure. For instance, non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, commonly taken for arthritis pain, can raise your blood pressure by an average of 5 points. When taken regularly, they can also reduce the effectiveness of nearly every class of blood pressure medication. Yet studies show that over 40% of seniors on blood pressure medication also regularly take NSAIDs without realizing the contradiction. Certain antidepressants, particularly venlafaxine and duloxetine, commonly prescribed for both depression and nerve pain in seniors, can elevate blood pressure significantly. Meanwhile, some Parkinson's medications and even certain antibiotics can cause dangerous drops in blood pressure when combined with hypertension treatments. What makes this particularly dangerous is that as you age, your liver and kidneys process medications differently. The same combination of drugs that was safe for you at 65 may become dangerous by 75 or 80, even if nothing else has changed in your regimen. Here's what's truly life-saving. At least twice a year, you need a comprehensive medication review with a pharmacist who specializes in geriatric care, not just your blood pressure medications, every prescription, over-the-counter drug, supplement, and herbal remedy you take. Many seniors don't realize that their pharmacist can provide this service, often covered by insurance, and it's far more detailed than what your doctor can do during a regular appointment. During this review, bring your actual blood pressure readings from home monitoring, not just the official diagnosis in your chart. The patterns in these readings often reveal interactions that might otherwise be missed. What we've found is that nearly 30% of seniors discover at least one significant medication interaction affecting their blood pressure during these reviews. Making adjustments based on these findings has prevented countless emergencies among the seniors I've worked with. If you remember nothing else from our time together today, Remember this, your blood pressure is not an isolated system. It's influenced by everything else happening in your body and every substance you put into it. This complexity increases with age, and the stakes get higher with each passing year. Final insight. As we reach the end of our time together, I want to leave you with the most important insight I've gained from working with thousands of seniors on their cardiovascular health. This is the understanding that has transformed lives and quite literally saved many of them. Your blood pressure journey is unique. The exact same medication, diet, and lifestyle that works perfectly for your spouse or your best friend might be completely wrong for you. The standardized guidelines, while helpful, cannot account for the beautiful complexity of your individual body, your specific genetic makeup, and your particular life circumstances. This is why taking ownership of your blood pressure management is so crucial. It's not about replacing medical advice, it's about becoming an informed partner in your own care. It's about understanding that you have more control than you've been led to believe. The seniors who thrive into their 80s and 90s with healthy cardiovascular systems aren't just the ones who dutifully take their pills. They're the ones who become deeply attuned to their bodies, who notice patterns, who ask questions, who make connections between their lifestyle choices and how they feel. They're the ones who understand that managing blood pressure isn't just about avoiding a catastrophic event like a stroke. It's about preserving the quality of every day, your energy, your cognitive clarity, your emotional stability, your ability to remain independent and engaged with life. So yes, follow your doctor's advice, take your medications as prescribed, monitor your numbers, but also trust your experience. Notice how different foods make you feel. Pay attention to how stress affects your readings. Observe how your sleep quality impacts your morning numbers. This body wisdom, combined with medical guidance, is your most powerful protection. What I hope you take from our conversation today is not fear, but empowerment. The mistakes we've discussed are common because managing blood pressure as a senior is genuinely complex. But with awareness comes the ability to avoid these pitfalls. With knowledge comes control. Your remaining years can be vibrant, active, and healthy. Your blood pressure doesn't have to be the limiting factor in what you can experience and enjoy. By avoiding these 7 critical mistakes, you're not just adding years to your life, you're adding life to your years. Thank you for staying with me until the end. If this information helped you, please share it with someone else who might need it. We're all in this journey together, and knowledge shared is knowledge multiplied. Closing reflection. Before we part ways, I want you to take a moment and reflect. Think about one insight from our conversation today that particularly resonated with you, one change you might make to your routine tomorrow morning, one question you might ask your doctor at your next appointment. That single action, that one adjustment, could be the beginning of a transformation in how you experience your senior years. Your blood pressure is not just a medical reading, it's the force that powers every moment of your life. Treat it with the care and attention it deserves. Stay well, stay informed, and remember, your best years may still be ahead of you.